And UnityPoint Health-Meriter nurses are pushing for change in their contracts, including more protections against the pandemic.
If push comes to shove, they say they'll give a 10-day notice for a strike. Madeline O'Neill is live at Meriter Hospital, where nurses voiced their concerns to the public this afternoon. Maddie, what are they hoping for?
Well, demands include higher pay if nurses pick up shifts, more sick days and paid time off, and a raise after a year that's been like no other for healthcare workers.
2020 certainly was one heck of a year.
After a year full of change.
Nurses have never seen sicker patients in their entire lifetime.
Nurses at UnityPoint Health-Meriter are asking for some change of their own.
We've earned a decent raise, and that's what we're asking for.
That's not all.
We need sick time. We need to be able to take care of ourselves. We need to be able to take care of our families. We've also, another thing that we're working on is incentive pay. When there are extra shifts and we're asked to come in on our days off and to rearrange our schedules and our obligations, we're asking for that fair compensation.
Nurses are represented by SEIU Healthcare Wisconsin, the state's largest healthcare workers union. UnityPoint Health-Meriter tells us they believe their most recent proposal to SEIU is strong and fair, already having reached agreement on nearly 30 issues. The hospital says they're surprised nurses voted to authorize a 10-day notice strike.
It is not something that we want to do. It's not something that we're going to take very lightly. But it is something that is frankly an option if we absolutely have to.
In a statement, Meriter writes, quote, "The bargaining process is not without challenges, but we have always worked collaboratively to reach solutions without a disruption to patient care." Nurses say the disruption brought by the pandemic
We have not felt like we've been treated like heroes throughout the year.
Has uncovered broad issues that need addressing.
We're not the only nurses in town. We're not the only nurses in the state. And there are a lot of issues that have been raised with this pandemic that I think a lot of people need to realize what's going on.
Some UW Health nurses were at the press conference earlier today to show their support as well. Now, bargaining with the help of a federal mediator starts back up again tomorrow.